Gaucher disease is a rare genetic enzyme deficiency disorder. People with Gaucher disease lack sufficient activity of an enzyme called glucocerebrosidase, which helps the body to break down worn-out cells. The process of diagnosing Gaucher disease is not always straightforward. This can lead to delays in diagnosis and access to appropriate treatments. In this film, families and physicians in different parts of the world speak about their diagnostic journeys to raise awareness of the importance of the power of knowledge in a timely diagnosis.
Chamo-me Naisa Manati, sou portadora de doença do Gaucher. A minha história começa por volta dos 5 anos de idade, quando meus pais me levaram pela primeira vez ao hospital por conta do tamanho da minha barriga, que era muito grande.
Meus pais Zé Macão disseram que nós estávamos a ver nada, devíamos ficar em casa alguns meses e caso a situação mantivesse ou a barriga continuasse a crescer, voltavam. Foi quando fez uma transferência para aqui no Hospital Central.
Foi feita a primeira avaliação, olharam-se os dados da história clínica e realmente ficou patente que ela tinha uma doença de depósito. Uma das coisas que ressaltou logo à primeira vista foi o fato dela ter um quadro multissistémico, portanto com hepatosplenomegalia, que é aumento do volume do baço, aumento do volume do fígado, epistaxis, ou cansaço e, por último, a biópsia que foi feita, que confirmou que realmente estava-se diante de um quadro de doença de depósito. Esta demora que houve para a confirmação do diagnóstico, porque a Liza já era seguida no Hospital Central desde 2016, mas só se confirmou o diagnóstico praticamente em 2020, isto mostra uma das dificuldades que existe no manejo das doenças raras. Ora,
I was diagnosed with this disease at earlier stage at the age of 3. At that time, my spleen was increasing day by day, some bone pains and nose bleeding. We referred to locally doctor, but no one can diagnose about this disease as no one was aware of this kind of disease, as this is a rare genetic disease.
When my illness was discovered, I was only 4 years old. I wasn't aware of it.
Na samom početku otkrivanja Anđeline bolesti imali smo dosta problema samim tim što dolazimo iz male sredine gde ni lekari nisu čuli nikad za Gaucherovu bolest. Anđela je imala česte infekcije, padove imuniteta, stalno je bila bolesna. Tako smo se borili do njene 4. godine kada je u jako teškom stanju prevezena za Beograd, ovdje u Tiršovu.
Our first thoughts were we were considering the usual infections of the childhood, which present with these symptoms and signs. So we first thought about infectious mononucleosis, but after we excluded it due to pretty pronounced thrombocytopenia, we performed a bone marrow puncture because we could not exclude the acute lymphoblastic leukemia as the most common malignancy of the childhood. And after performing the bone marrow and after not having seen any leukemic blast cells in the bone marrow, we were thinking about some more rare conditions. So on this, I would say, algorithmic step number 3 or 4, we considered Gaucher disease, so we also ordered the enzyme analysis for the child, and of course it came back positive, so we made the diagnosis of Gaucher disease. It was a bit of a challenge to make the diagnosis of Gaucher disease in Angela, in our patient, because we usually see the well patients with Gaucher disease in our outpatient units. For example, we see the children that have no cytopenias, they feel well, they only have palpable spleen or a large spleen, so that's the way we usually discover them in Serbia. But this case was a little bit more difficult, so we passed through a little forest of differentials before making the definite diagnosis.
Olá, meu nome é Nelson Minato Júnior, tenho 62 anos. Os sintomas eu tive quando eu tinha 14 anos de idade, ou seja, isso na década de 1970. E eu tive primeiro uma anemia muito grande, que me chegou a levar quase à morte. Essa anemia, eu fui a um médico que era bem conceituado na minha cidade, o Dr. Juvino, e ele que levantou essa possibilidade de eu ser portador da síndrome de Gaucher. O maior dos desafios foi que na época em que eu fui diagnosticado, com 14 anos, não existia internet, não existia, digamos assim, os meios de comunicação como existem hoje. Poucos médicos, raros médicos, conheciam esse tipo de síndrome.
In India at that time, medicine was not available, so we somehow managed my symptoms.
When Mateo was first diagnosed, he was a newborn. We received his diagnosis through the newborn screening, and we looked all over the country to find the best specialist that we could for Mateo. It was an overwhelming feeling of the unknown. We didn't know because it's such a rare disorder. We didn't know what the future would hold for Mateo. We didn't know how to find the resources and the support that we needed.
You know, we turned to Facebook to find some of the best information, right? It was really hard. We initially had kind of a struggle with the initial specialist, and we just didn't have the resources or nowhere to go because we had no familiarity with the disease or the support network. And so, you know, the first line of defense for us was Facebook. People who were complete strangers to us were some of the best support networks for us to find out what doctors to see, what treatment looked like, what life with Gaucher, with kids with Gaucher looked like.
We initially received an opinion that from a doctor that said he shouldn't get any treatment at all. And then we found a different doctor, and we saw other doctors, and there were such differing opinions about what should be done because he was diagnosed so early, and not many kids had been diagnosed early. So there was really kind of these differing opinions about what was the best route to go.
Yo no tenía conocimiento absoluto, no tenía nada de conocimiento sobre esa enfermedad, pues al darnos ese diagnóstico para nosotros como padres fue algo desconocido como para muchas personas que pueden escuchar el nombre Gaucher, ¿no? Entonces, y bueno, ¿cómo le ha ayudado recibir el diagnóstico para planificar el futuro, ¿no? Junto a su hijo? Nos ha ayudado bastante, pues todo el tiempo que Vasco estuvo sin diagnóstico y con síntomas que incrementaban cada vez. Era muy complicado tanto para él como un niño, porque estaba en la edad donde él pues quería hacer lo que hace un niño, ¿no? Y para nosotros como padres nos limitamos en muchas cosas también. En cuanto para mí fue esto desarrollarme de repente profesionalmente, en trabajo y seguir trabajando. Mi esposo también estuvo emocionalmente, estuvo mal, afectó a toda la familia. Pero al momento de nosotros recibir el diagnóstico, claro, ¿no? Fue algo que nosotros no esperábamos, pero fue como un alivio, porque ya sabíamos qué era lo que tenía, cuál era su diagnóstico, cuál era la enfermedad y que existía un tratamiento. En la actualidad existimos solamente 15 especialistas en nuestro país, particularmente yo fui formada en la Universidad de São Paulo en Brasil, en el cual pues nosotros manejábamos en un consultorio a todos estos pacientes. Entonces se nos hacía de forma rutinaria el diagnóstico y ver este tipo de pacientes desde el inicio, muchas veces desde la primera infancia, primer año, segundo año, y la evolución en aquellos pacientes adultos que no recibieron tratamiento enzimático. Lamentablemente en nuestro país los estudios sean enzimáticos o directamente de estudios de ADN no se realizan, ya sea por el costo, por el desconocimiento y porque no se pone un realce a la importancia de esos diagnósticos en edad temprana. Entonces tenemos algunos laboratorios que nos hacen estos estudios en forma gratuita, que nos apoyan en los países que somos de tercer mundo. Lo único que hacemos es tomar las muestras a los pacientes y los enviamos fuera. El tiempo en el cual nosotros tenemos los resultados debería de ser menos de una semana o 2 semanas, pero por el mismo hecho de salir del país toman a veces hasta 1 mes o 2 meses en tiempo de resultado. Resultado el cual pues de alguna manera perjudica al paciente en el inicio del tratamiento. Vasco empezó a recibir tratamiento después de los 4 años. Lamentablemente, pues si hubiera recibido antes, podríamos inclusive disminuir los efectos colaterales o las complicaciones.
And sometimes you get a history of a sibling who may have passed on without a diagnosis. So that definitely makes you think about metabolic disease, and Gaucher is one of those. In terms of the challenges managing, we don't have very many doctors who are taking care of children with Gaucher's disease, and so you don't have a good network where you can discuss the different cases and brainstorm together. And so it's a bit of a lonely journey, yeah. But it has improved with time, and not just with the doctors, but also with the collaboration and help, including patients and collaborations like International Gaucher's Association and Rare Diseases of Kenya. So that has come alongside and made it a lot more in the minds of doctors and patients, and yeah, it has improved that.
Não é fácil fazer o tratamento da doença da Gaucher. O Ministério da Saúde teve que entrar em contato com outro país que é o Brasil. E o Brasil, por sua vez, entrou em contato com outro país que é os Estados Unidos da América para medicamente poder ajudar aqui em uma Então, é um tratamento muito caro que, se fosse por mim para postear as despesas nesse tipo de tratamento, eu não ia conseguir. Por isso que eu sinto-me bastante feliz.
After some years, I got ERT, enzyme replacement therapy, taken twice a month. As of now, I am on ERT and living my life as a normal person.
The only available treatment at the time was the ERT, or the enzyme replacement treatment. So that's what we gave the patient, and that's we started as a chronic substitution treatment for the patient.
The barriers I have are that I need to travel to Belgrade every 14 days because of my medical treatment, and I'm absent from school a lot.
El tema de apoyo emocional, sí, Vasco lo tiene, pero de forma particular, ¿no? El hospital sí tiene, el hospital donde Vasco recibe tratamiento sí tiene también el servicio, pero el tema de las citas son un poco prolongadas, entonces te he elegido la opción de que lo haga de forma particular. Terapias, él hace terapias de medicina en física, rehabilitación, sí las hace en el hospital. En cuanto al tratamiento, tenemos ahí un poco de, se podría decir como un problema, ¿no? No problema, sino una dificultad, ¿no? Porque el tratamiento que Vasco recibe no recibe en la ciudad de Lima, no en mi ciudad. Entonces, nosotros cada 15 días tenemos que hacer un viaje, ¿no? Y viajamos a la ciudad de Lima, la capital, y ahí Vasco recibe los tratamientos cada 15 días.
There's a lot of factors that go into determining whether people can have in-home infusions rather than infusions at an infusion center or a hospital, which is where Mateo started, and then we eventually moved to the in-home infusions.
There are some people with Gaucher type 1, which is not what Mateo's diagnosed with, but they're able to take it as a pill once a day or twice a day or however many times prescribed. Mateo's, his treatment is enzyme replacement therapy, and so he essentially gets a weekly infusion. And those are the two options, and that's patient and doctor specific, based on what works best for the Gaucher patient.
Eu convivi, então, com o meu problema até por volta dos meus 39 anos e meio. Me foi indicado um tratamento junto à Unicamp, que é a Universidade de Campinas, uma das maiores e melhores universidades do Brasil, normalmente na parte de medicina. E chegando na Unicamp com o diagnóstico de Gaucher, aí foi que eu teria que receber essa medicação, e essa medicação é entregue graças ao SUS, que é o Sistema Único de Saúde implantado aqui no Brasil, de forma gratuita, o que também dá uma certa confiança para a gente no próprio tratamento, porque Nós sabemos que essa medicação não é barata.
It's easier to make the diagnosis now. I think there's more awareness, so patients are referred slightly earlier. But we also have help in terms of the diagnostic tests, and those are done easier now. I think it's a grant that helps with the diagnostics, especially for the rare diseases, and that's done from Gertrude, and so that is available now for even people who can't afford the test.
Upoznala sam ljude iz udruženja Ugoša kao i direktoricu koja je sama pacijent Goševe bolesti i preko njih sam saznala dosta informacija o daljem lečenju, o napredovanju lečenju. Upoznala sam dosta pacijenata, razmenili iskustva, što je pomoglo da olakšamo i Anđeli i meni život kako sada, tako i u budućnosti.
Reaching out through agencies like the Gaucher Community Alliance, the International Gaucher Alliance, to find people that could help understand and support us throughout this. We're also very blessed with a lot of family support that helped us get through this experience. When Mateo started his in-home infusions, because they were at an infusion clinic for some time, but when we were able to get them at home and it was part of our routine and part of our family routine and part of our everyday life, we felt like we could manage this. This is going to be okay. We have what we need to make Mateo's life the best that it could be. That's really, I think, for me, when I felt a sense that we were going to be okay, Mateo was going to be okay, and we were going to work through it, and we had the resources to work through it because we had found a network of people.
The advice I'd have for other healthcare professionals would be to, first of all, think about it. It is rare, but it is there. And so if you have a child who has some of these symptoms and you cannot figure out what it is, think about Gaucher disease. Secondly, there's help out there. There's now a number of us who are taking care of these children, and we are happy, more than happy actually, to just step in and help you make the diagnosis and walk you through management. And then work with the collaborators and work with the patients, because it's a long journey, it's a lifelong journey. So you need to establish a good rapport and keep going. Be very open and real with the parents. Know exactly what are the challenges that they have. Some challenges could be medical, some could be non-medical, but they all need to be addressed. So you need to be there for them.
Uma coisa que eu quero deixar para todos é o seguinte: não se limite à sua deficiência. Não é deficiência, você é assim. Você tem que ter em mente que se você nasceu dessa forma, você tem condição de vencer na forma em que você nasceu, do jeito que você nasceu. Obviamente, procure viver da maneira que você mais se sinta bem. Não dê ouvidos a terceiros que digam: você não pode fazer isso por conta disso, você não pode fazer aquilo por conta disso. Desde que não ponha a sua saúde, a sua integridade física, ou que isso cause algum problema por conta da sua doença, não há limitação. Não há limitação. Eu creio que nós temos que ter em mente que nós podemos tudo. Nós podemos tudo, desde que tenhamos vontade de fazer.
O meu sonho é ser médica. Eu também, o meu desejo é conseguir encontrar outras pessoas aqui no meu país que possam ter essa doença e que consigam tratamento. Porque eu não esperava que conseguiria uma coisa dessas, como a primeira pessoa quando eu cheguei em Moçambique, logo a primeira a conseguir acesso a esse tratamento. Então, muito feliz, não imaginava mesmo.